Hey guys, I wanted to come on and just give you a quick video on something that's came up in the clinic quite a bit as of recent. The issue on to image or not to image before chiropractic care. We've had a lot of folks come in and say previous providers, whether it's a chiro, a PT, a medical doctor, an orthopedist, really hung their hat on what the imaging findings were. And after looking through several different sets of data, doing some literature reviews on some of the most current research on imaging, we found that imaging, though useful when there's a red flag such as a traumatic injury, potential for cancer or infection, fracture, those types of things, of course we need to get some imaging on that. But for low back pain, for neck pain, for mid back pain, is that the first offense? The literature says no. And a couple years ago, there was a very large literature review of over 3,100 patients that had zero symptoms. So they were not presenting with pain. And that study showed that 20-year-olds in that 20 to 29 population, that 37% of them already had degeneration in their spine. That's insane, right? You think you're young, you're viable, it's like the best years of your life. And 37% of them had degeneration, but no pain. No pain, that's a big key. Now, of that population, another 30% of those people had disc bulges on MRIs. Again, no pain. If you want to go to the next step and have a disc protrusion or slight herniation, 29%, so almost the exact same percentage as the bulge population, had issues with the disc. And then the little outer layer of the disc, the annular layers, 19% of them had tears in that. And that's where you can get full-blown herniations, sequestrations, where the disc material actually leaks out and can put pressure on the nerve root. Well, let's fast forward. And in 80-year-olds, 96% of them had degeneration. So what does that tell us? That's kind of like getting wrinkles on your face. If you live long enough, you're going to get some spinal degeneration. So that's key. Again, these people had no pain, even in the 80-year-old population. 84% had disc bulges, 43% had protrusions, and 29% had annular tears. So you guys can do the math as well as I can, those age ranges in between if you happen to fall into that. But overall, in the United States, low back pain will bother 66 to 80% of our population at least one time throughout your life. And the cost of low back pain related disorders to the United States alone is over $100 billion, which is absolutely unbelievable. And 2/3 of that is due to lost wages. So your back hurts and you can't go to work. You are having to pay for therapies like we provide in our office, or PT, or whatever the case might be. So what do we do with all of this information? So what we found out is lots of people have back pain, that have findings in their back, don't have back pain, are walking around out on this earth. Okay, well that's great. That means they're coping well, but is that a ticking time bomb? Potentially. So we also have heard from several different providers that they will just do routine imaging when coming in for chiropractic care, physical therapy, medical care, whatever the case might be. And another literature review kind of debunked that whole imaging pre and imaging post treatment. So if we have 3,100 people from this literature review that have positive findings in X-ray or MRI, but they don't have any pain that is consistent with those imaging findings, why on earth would we go ahead and re-image at the end to see if we've improved anything? You can't change degeneration. You might be able to improve the function of that human, but the biggest problem with this is if you're taking routine images, you are going to assign that person with a diagnosis, and that puts a little bit of fear in our patient population. So it affects that psychosocial aspect. I have a disc bulge, I have a permanent disability, and that's just not the case. There is a lot you can do with these findings. I mean, it's proof in the pudding. We're walking around healthfully and we don't even know that something's going on. So what do we do about it? We need to classify our patients and make sure there's no red flags, as we talked about. And Just a thorough history and an examination alone is about 99% sensitive. I was reading this right out of this textbook, Rehabilitation of the Spine, Dr. Craig Liebenson, really, really fantastic chiro out in LA. 99% sensitive to give the go-ahead run for imaging. I think that's really important for us to appreciate. We have the skill sets as physicians to classify these patients without even touching them potentially. Next up in our office is a movement assessment, and this is where we can really gain appreciation. If somebody is working through pain, or even if they're asymptomatic, we're going to be able to look at those biomechanical indicators to see if they have something that is future potential impact on their spinal health or their extremity health. And we think that the movement assessment is really the next best thing outside of our history and examination that we can do for our patients. And we've helped thousands of people that have gone to other places that have had these other maybe unnecessary procedures done just by essentially watching the way that they move. It's unbelievable. And then from there, once we decide that there's no red flags, if we've gotten the images, we use that information to proceed forward with a trial of care. If we just see that the movement screen is a go-ahead run, then we use that. And, if we're not getting results, results means if we're not able to achieve at least a 40% improvement at the 30-day mark, we need to start seriously thinking what we've done treatment-wise and if we need to refer this patient on to the next step. So if you've been scared by your imaging findings, or if you have imaging findings that you feel are limiting you in your life, come to Focus on Health. Let's do a movement assessment. Let's see if there's something we can do to help you out with, and let's see if we can help you live a better life. I hope this was helpful. Drop any comments or questions in the spaces below, and I hope you guys have a fantastic weekend.